Cross live now to the South Australian Health Minister, Stephen Wade. Thanks for joining us, Stephen. We'll get to that in just a second. But first up, I need to get your reaction to your 4 colleagues, 3 ministerial colleagues and the President of the Upper House, all having to resign because of rorting entitlements. It must absolutely disgust you that they do that to your government and to public faith in politicians.
It is very disappointing, and the Premier made it clear that the distraction was unacceptable. He's acted decisively, and today we've had new appointments made to the ministry. Looking forward very much to working with a refreshed team with a renewed vigour.
But it's not about the distraction, isn't it? It's about the deception and the rorting. If $70,000 has been paid back, obviously it's money that they weren't entitled to. Politicians don't get money accidentally. They knew what they were doing, didn't they?
This is a matter that's now before the ICAC is in independent review. There'll also be work done at the Remuneration Tribunal to make very clear how these allowances will operate moving forward.
How would you describe your feelings about this? Anger, disappointment?
It is disappointing, but as Health Minister, I'm completely focused on both the economic and the health challenges that coronavirus creates for our state. The Premier made it clear that that's what his government is determined to deliver for South Australians. This is a dual crisis. The events of recent weeks have been a distraction from that when we need to be completely focused on the coronavirus.
Now, you and I have talked about border closures a lot. Principally, I was opposed to them. In hindsight, you were right. You shouldn't have had to close state borders, but from what's happened in Victoria, it's provided a hell of a safeguard for people of South Australia, including my parents. Just how heavily fortified is that border now? I hear you have drones and helicopters and police vehicles chasing escaping Victorians across the border.
Well, we're very grateful to both the work being done by SA Police and also now the Australian Defence Forces who are helping secure that border. It is very disappointing to see numerous people just ignoring the law, ignoring the controls in place and trying to run the border. And numerous cases have been detained and actions been taken. This is unprecedented. In 1919, during the Spanish flu, we did close our border to Victorians, but my understanding this is the first time we've closed the borders to our own citizens. And so South Australians hoping to return from Victoria to South Australia won't be able to do so beyond midnight tonight unless they're an essential traveller. This is all about protecting the health and safety of South Australians. During the first wave, the source of transmission was very much overseas acquired. 70% of the cases in South Australia are overseas acquired. Now the threat is from Victoria, and so it's very important that we close down the movement. We'll continue to support our Victorian colleagues. We're continuing to discuss with them what support we can offer. We've engaged epidemiologists, contract tracers, nurses, paramedics, certainly helping our Victorian colleagues to deal with the outbreak is the first line of defence to protect the health and safety of South Australians.
Just one thing quickly before we run out of time, aged care homes. Now, the regimes are slightly different from state to state. There's private, federal, state regimes. Is it possible to protect aged care homes properly from this virus? Because surely after borders, that has to be the #1 priority.
Indeed, and we're learning a lot from overseas and from Victoria. The South Australian government made the decision some months ago that we would change our strategy for outbreaks in aged care facilities. Our strategy is if we have a single case in an aged care facility, we'll remove that person. We believe that the challenge of trying to maintain a COVID-19 outbreak within an aged care facility is not a risk that we think is worth taking. So we've been working very closely with aged care providers on a strategy that is basically distinctly different from most other states and territories, if not all states and territories. And we're hoping that if there is an outbreak in South Australia, that will help us protect our senior citizens.
That's fascinating. Thanks for joining us, Stephen.
Thanks, Chris.
Stephen Wade there, the South Australian Health Minister. That's fascinating. Their policy is anybody gets infected with COVID-19 in an aged care facility, they'll get them out into a hospital. We'll be having more on this issue tomorrow with other experts calling for more federal intervention when it comes to aged care homes.